Hello, my name is Dr Munir Somji. I'm a cosmetic surgeon here at DrMediSpa. Today we're going to be talking about FaceTite. It's commonly known as the no-knife facelift. It yields fantastic results for patients of all age range. I am a registered trainer for FaceTite and one of the key opinion leaders. We're also one of the busiest clinics for FaceTite in the UK and in Europe too. What is FaceTite? So FaceTite is a radiofrequency surgical tightening treatment, and it's performed through keyhole incisions that are located in specific areas on the face. So it can be used to address a number of different areas. So some of the most commonest areas tend to be in the lower part of the face, so jowls. So if we think about my concept of aging, I talk about the 3 Ds. One of them is deflation. So we've talked about it in other videos in terms of addressing this with filler and also in fat. So that we lose volume from the upper part of the face, and improving volume in the upper part of the face can lift the face too. But there's only a limit it can do for the lower part of the face. So FaceTite addresses one of the Ds, and that's descent. So as we age, the fat also descends down on the face, and FaceTite can be used to actually reposition that fat and also tighten it too. The other D is deterioration of skin. FaceTite is commonly paired with a number of skin tightening treatments such as lasers as well as Fractura, which is needled radiofrequency, to tighten the superficial layers of the skin. FaceTite is something that we perform on a daily basis to address both descent and deterioration of skin. How is it performed? Well, it's performed under local anaesthetic, so patients are commonly awake and sometimes lightly sedated during the procedure. I mark out the areas which I wish to tighten, so it could be the jowls, straightening up the jawline, and also the pocket of fat that sits underneath the chin too, and also tightening the neck as well. There are different probes which we'll talk about in later videos which are specific for the upper part of the face too. Once we perform the procedure under local anaesthetic, it takes about an hour or so under local anaesthetic and is quite comfortable. Patients rarely complain about excessive pain. You can also get some swelling after the procedure, which does last for up to a week. So I always tell patients, look, just take 10 days out of your schedule to ensure that you're fully healed. At the end of the procedure here at DrMediSpa, I don't believe in just tightening the lower levels of the skin. I also want to tighten the upper levels of the skin too during that procedure, for the fine lines and wrinkles that are there as well. So we commonly perform this treatment with needled radiofrequency such as Fractura or Morpheus, which we'll talk about also at a later date. And then once the patients are also healed, we get you back into the clinic at 2 weeks for a review to make sure that all the small incisions that we make, the 2mm incisions, are healing up nicely. Those incisions, incidentally, rarely need a stitch and they hardly leave a scar. We call them stealth incisions because they're hidden in areas where no one can actually see them. So if you're after something which actually gives you facelift results and surgical results without large scars, then FaceTite is a treatment that is fantastic for you.